Welcome back to Living 808. Dr. Paul Norio Morton is a well-known orthopedic surgeon known for his specialty in robotic-assisted surgery. But before we get into that, let's find out a little bit more about this local boy who came home to practice medicine using the latest technology for the best outcomes for his patient. We welcome in Dr. Morton, the robot doc. Thanks for being here. Appreciate it.
Hi, good morning.
Yeah, this is awesome. I see you on TV a lot, so that's a good thing that you finally got over to see us here at Living 808. Do me a favor. Tell our viewers a little bit about your background.
So I was born in Hawaii. I grew up on the Big Island. Originally, I graduated from Keao High School and left for college and eventually came back and I did fire and EMS as a firefighter while I was in college. And then I came back home, went to John A. Burns School of Medicine, and then left again for a residency and eventually came back to start my practice here in Hawaii. So
you went into the fire department and you were with EMS, then went to med school?
Yes.
Okay, you're crazy. We love that though, that's awesome, because you did a lot of work before you went in there.
Yeah, so in Ohio they have a lot of times you kind of do both, you train as both in both fire and EMS, and so that's...
oh, that's great.
As I was training, and I was training to become a paramedic, I really like going into the hospital. I enjoyed doing trauma. I really like to take care of patients, and I wanted to see, hey, you know, what happens after these patients end up going in the hospital.
Okay, well, with that said, taking care of patients, you're learning some of the best ways to take care of folks, and they call you the robot doc. Can you tell us a little bit about that?
Sure. So when I did all of my, when I was in training and I was looking at different types of medicine I could go into, I really enjoyed arthroplasty. I found putting in hips and knees was really was something that I found enjoyable. I see my patients get up and return to their lifestyle very quickly, and you go from being in pain to living life without pain. And for me, you know, I'm always looking to try to increase by just 1% or 0.1%. And with robotics, it gives me the ability to put in my implants more accurately. It allows me to balance my implants better than I would be able to with traditional surgery. And so robotics gives me an edge, I think.
And we're seeing a little bit about the robotics here. This must make surgery a lot less invasive. Is that correct?
So yeah, I mean, I think with the robotic techniques, I'm able to do less soft tissue releases than compared to normal. I'm able to cut less. My incisions are smaller, and I'm able to get my patients to return to action a lot sooner.
And the benefits are like what you said, just less, I would imagine, less pain, less downtime. People are getting back and normal quicker.
Correct. You know, most of my patients are actually going home on the day of surgery. So traditionally, a lot of patients would stay in the hospital 2, even 5 days. But I'd say a significant majority of my patients are actually able to go home safely at this point.
Speaking of home, you got an office here, but you also do work in Kona.
Correct. So I'm here in town during the first half of the week, Monday, Tuesday, Wednesday. And then at the end of the week, Thursday and Friday, I fly over to Elite Health at Kona Community Hospital, where I do both, you know, hip and knee replacements and take care of patients in the community.
You're busy. Yeah. You're a busy guy. but it sounds like you just enjoy it.
Yeah, I really love what I do. I had the ability to get into what I'm passionate about, which is really hip and knee replacements, and it really lets me, you know, get people back to normal.
Okay. Anything else you'd like to share? Because I know that a little birdie told me you had some other exciting news.
So some of the things that we're doing, we're not just doing robotic joint replacements anymore. There's the ability to put in smart implants, which also allow us to track how well we're doing. We can measure our outcomes, see how much range of motion we're actually accomplishing, and it's using technology that is new. Some of the, especially with a knee replacement, we can now attach on the bottom of our knee replacements right here. We can attach a smart implant and actually
show that. Can you pull that out again? I just want to show the camera real quick.
So knee replacements consist of, you know, a thigh bone component and a shin bone component. And at the bottom of our shin bone component, we can place a small smart implant using the same technology you use as a pacemaker. And that technology really enables you to see how our knees are performing, and hopefully if there's any, we're trying to improve outcomes, so we're looking for that 1% that don't do as well 10 years out, and it gives us the ability to track that.
You have another model here. What is that showing us?
So the other model is our hip replacement. So one of the exciting things that we're doing is not only are we doing knee replacements with robotics, but we're able to use the robot to really place our hip replacement implants. So traditionally, you'd kind of use X-ray to do your best to try to place these implants, and you'd hold the jig to hold in the implant in a certain position. Well, the robot really attaches to the implant and gives you one straight line to impact your implant, and gives you hopefully the ability to keep your implants in a better position and heal better than they would without that same, the traditional method of putting in hips.
Amazing. I like the toys, but I also like learning about why you're using them. That's awesome. Somebody needs your help. Somebody wants to learn a little bit more about how you could possibly help them. How do they get in touch with you? How can they follow you? Go to the website. Give us that information.
So I have a lot of information on my website. Okay. So if you go to www.drmorton.com, that's spelled out. And you can also call my office at 808-439-6201. You can reach me both on the Big Island and on Oahu there.
Perfect. So, so the other folks on the other neighbor islands could just fly on over and see you at either one of the places.
Correct.
Perfect. Thank you so much for being here. I learned a lot from you already today, and good luck to you, and congratulations. Thank you so much for being with us here. I appreciate it.
Absolutely. Thanks for having me.
We got to take a quick break. I'm going to talk to him a little bit more during the break, but when we come back, we've invited Kei Mukaigawa back for a real estate update, and we've got, that's going to be a little bit later on in Living at 08. But first, we're going to go to the Surf Jack Hotel and talk about both accommodations and the grinds. We'll be right back.